Hello, my name is Dr. Rebecca Booth, and I'm a gynecologist in Louisville, Kentucky. I've been in practice for over 20 years with Women First. I graduated from the University of Louisville Medical School and finished my training in OBGYN in 1989. As a gynecologist, I have a special interest in hormonal wellness and in minimally invasive surgery. I'm the author of The Venus Week, Discover the Powerful Secret of Your Cycle at Any Age. What is menopause? What are the symptoms? I like to refer to menopause as programmed ovarian retirement. Basically, it's a time in a life when a woman is designed to stop having her hormonal cycles. This is something that Mother Nature plans to sort of place us in what I call the off-duty state. It's not exactly a disease. However, the symptoms that may occur can feel like a disease. They can range everything from mild irritability to debilitating hot flashes, insomnia, panic attacks, anxiety, and decreased interest in sex. Fortunately, these are all quite treatable. If I keep my ovaries, will I go through menopause? The ovaries are designed to retire, and this plan actually begins before a young girl is even born. All women, if they live long enough, eventually will have this process of what I call ovarian retirement, when their ovaries stop ovulating and essentially the eggs simply run out, having almost been spent by Mother Nature's plan to have at least some fertilized. The result is menopause, a stopping of the fertility cycle. The main hormones from the ovaries are generated when puberty essentially ripens one egg a month and empowers the egg to support the monthly cycle or a pregnancy. When the eggs are finished, the hormones sharply decline, and this results in menopause. If my ovaries are removed, will I need hormones? The need for hormones with surgical ovarian removal depends strongly on the age of the woman when she has such a procedure. The average age for menopause is approximately 51 and a half, so a woman under that age may want to have support for her hormonal health until her body would have experienced menopause naturally. On the other hand, hormone therapy does carry some risk, so it must be an individualized decision for each woman. A woman well beyond the age of menopause, say a woman who is 65 or older, has already gone through the process of what I call ovarian retirement. And if her ovaries are removed, she typically would not need to consider hormone therapy unless she was already taking it. Is hormone replacement safe? Hormone therapy is a very controversial area in medicine, mainly because menopause is not a disease, so even the term hormone replacement is somewhat misleading. That being said, there are many processes of what's now being referred to as hormonal aging that uniquely affect women and may result in a decision to take hormone therapy. For example, bone loss is more common after menopause and can lead to an increase in both hip and spinal fractures that can be extremely debilitating. A woman may opt to take hormone therapy to prevent this disorder or to treat incapacitating hot flashes, menopausal insomnia, or sexual problems. There are risks with hormone therapy, namely estrogen, the female reproductive hormone, increases a woman's tendency to form a blood clot, and this can increase the risk for stroke and deep venous clot formation. Also, estrogen taken in combination with progestin or progesterone, which is necessary if a woman has a uterus, may increase the risk of breast cancer after about 4 or 5 years of use. Hormone therapy in the menopausal population also increases the risk for gallbladder disease and does not have any proven positive effect on the heart. In fact, combination hormone therapy may slightly increase the risk of heart disease. Single estrogen therapy in a woman who has had a hysterectomy is relatively more safe and is not associated with an increase in breast cancer. This points out the importance of individualized treatment. Can I manage menopause without ovaries and without hormone therapy? Certainly. Most women opt to not take hormone therapy, mainly because of the risks, cost, and the fact that menopause is a normal process. Most women manage their symptoms and the process of hormonal aging without hormones. It is very important to be aware of how the body changes with menopause or surgical ovarian removal, such as the implications for bone health as well as quality of life measures, sexuality, etc. All of these arenas can be dealt with a gynecologist or an expert in the area of hormonal wellness to assist in lifestyle adaptations during and after menopause, with or without hormone therapy. What treatments are available for vaginal dryness? Vaginal dryness is extremely common and is often the result of low estrogen and the resultant loss of collagen and elasticity in the vaginal skin. While a woman can make herself more slippery with lubricants, elasticity is typically the result of estrogen or estrogen therapy. The combination of lubricants and gentle stretching of the vaginal tissues can be effective, such as that with use of a dilator. But many clinicians feel that topical vaginal estrogen treatments are completely safe. These topical treatments are widely used and can relieve the loss of elasticity and discomfort associated with vaginal dryness.